Welcome to the Cystic Fibrosis Care Center virtual tour video. Mission's Cystic Fibrosis Care Center is located in the Reuter Outpatient Center on Vanderbilt Park Drive and offers a full range of pediatric services for CF patients, including pediatric endocrinology and pediatric gastroenterology. At registration, CF patients are given special attention. They are provided with a mask and taken directly to an exam room to reduce the risk of any exposure to infection. All staff members who meet with the family wear personal protective equipment throughout the visit, including gowns, gloves, and masks. On CF clinic days, the CF care team can be found at the Pulmonary Nurses Station. Here, a board tracks the progress of each patient's visit, which specialists they have seen, and which tests and procedures they have completed. Our patients' CF Clinic Day may include meetings with physicians, respiratory therapists, nurses, dietitians, social workers, and physical therapists, as well as visits from pediatric lab technicians for blood work and radiology technicians for X-rays. To reduce infection risks, each CF care team member meets the patient in the exam room. Patients may leave the exam room only for pulmonary function tests and radiology services to use equipment that is not portable. Exam rooms are cleaned with disinfectant before and after each visit, and we take the additional precaution of limiting the use of exam rooms to one CF patient per day. As part of a CF clinic visit, our registered respiratory therapists use a diagnostic tool called a plethysmograph to check patients' lung function. During this procedure, the patient will clamp their nose and blow hard into the machine's mouthpiece. With the data obtained, our team will assess how well each patient's lungs are working that day to determine if lung disease is restrictive or obstructive, and we track each patient's results over time to watch for changes. A respiratory therapist will also collect a sputum sample or take a throat swab to check for bacteria in the airway. The radiology suite at the CF Care Center usually will see a CF patient once per year for a chest X-ray. This gives our pulmonologists an idea of how each patient's lung condition is progressing and allows us to detect signs of illness. Blood draws are performed in CF patients' exam rooms. Our lab technicians are specially trained to work with children, and our Child Life Services staff is available to support our pediatric patients during labs and other medical procedures. Typically, CF patients have blood drawn at least once a year to check levels of vitamins, liver function, and blood glucose. In addition to these standard tests, Mission's CF Care Center is the only lab in the region that performs sweat tests to diagnose CF in newborns. Thank you for taking some time to explore the Mission Cystic Fibrosis Care Center. We hope you and your family find your experience here rewarding and want you to know that Mission is continually investing in cutting-edge technology, design, and process improvement to maximize your comfort and create an environment where you and your family can relax and focus on what really matters.